Hey, happy spring, everybody. Hope you're enjoying this wonderful weather we're having here in New York. Want to talk a little bit about how long chiropractic adjustments last. I get people asking me all the time, I've heard when you get adjusted, you got to keep going back. And although that's true, I want to put some context around why that's true, to the effect of the body and the habits that we deal with structurally in our spine and in our core alignment patterns. So we look at a body, when I look at a patient, when I look at all my patients, I look at you the way an architect looks at blueprints. And the blueprints for me is a posture assessment, a balance, a range of motion test, and most importantly, the x-rays. We take structural standing x-rays, three-dimensional, and most of the times we use motion studies to determine which segments of the spine are not moving well. And so when we do that assessment, we find out where the postural patterns are bad, where they're good, what needs work, and what doesn't. And so when I start an adjustment program with a patient, my first comment to them when they're getting their first adjustment is that, listen, adjustments typically last anywhere from 7 to 12 hours, the first one. And what I mean by that is that range of 7 to 12 hours is how long an adjustment lasts before the body wants to go back to its old habit again. Quite frankly, listen, most of us have been subluxated or imbalanced since we're little boys and little girls. Most of the times when I see a patient, they're in crisis. The problem didn't start at crisis, it started when they were little boys and little girls. So think about it this way, if you didn't brush your teeth, floss your teeth, see your dentist till you were 35 to 37 years old, which is about the average age of our patients, if you had any teeth left in your face, what would they look like? Yeah, pretty rotten, right? So most people show up with pretty rotten spines because they've neglected them all those years, because their ignorance isn't born from their own accord. They just don't know that spinal hygiene is a thing. You get me? So the spine needs to be regularly maintained throughout your life from the beginning, not from when it starts to hurt. So we're already up against, we're behind the eight ball when we start with chiropractic because people have been subluxated for sometimes decades. I give them an adjustment, the body wants to go back to the old way because the habit of the ligaments, tendons, and muscles that hold their spine in place or out of place, they like it that way. So when I adjust someone, we move a bone, we get it moving again, we put it in its proper position, take pressure off the nerve, but we're affecting the ligaments, tendons, and muscles that already have scar tissue from years and decades of misuse. Does that make sense? So when I adjust someone, their body wants to go back to the old habit. So repetition is very important at the beginning to establish new habit and a new pattern of optimal function and optimal motion. And once we get that in, then the chiropractic adjustments can be spread out and spaced out longer and longer until we reach the ultimate goal, which is maintenance. You with me? So maintenance is really the goal for all of our patients. Sometimes we got to get through the crisis and fix the problem before we get to maintenance. So I hope that helps. I hope that makes sense. Some people get miraculous change and miraculous relief from their first adjustment, but for most of us, it takes time to have the rivulet of energy from brain to body through the nerve system start to work at optimal speed and amplitude before the body regenerates new cells. And healthier cells get replicated every 90 days. So remember, your body's like the seasons. So here we are in spring. Every 90 days, your body produces new cells. New cells are constantly replacing old ones, and the better your nerve system works, the better those cells are. So remember, stay informed and get adjusted.